Scott, my friend, good to see you again.
Hey, Joe, good to be with you.
Always, always. And by the way, that was a heck of an event. What was it, last month in DC on the
Yeah.
AdvaMed Board of Directors dinner?
Well, we were glad you were there. It was a lot of fun. Those board meetings and board events are always enjoyable. And I always leave them inspired because of the people who were there and the conversations we had. And Joe, you saw those, right? It's federal policymakers, but it's also the CEOs of virtually every major MedTech company around the globe is sitting around a table having conversations about what matters in healthcare. And I always leave excited about the future. So thanks for being a part of it. We appreciate it.
Always appreciate the inclusion there, and certainly me getting to see how the sausage is attempted to be made from time to time. But that's very typical for AdvaMed, Scott. We've got the big event coming up this fall, and that really, beside the dinner, which is for the board and the board members, the AdvaMed conference coming up, the MedTech conference coming up. That one is really, especially the last couple of years, you and the team have done magnificent things with it.
Yeah, well, thank you. It's an exciting event, right? It's beyond just, as you said, our board of directors and the CEO level connections that you will make at a board meeting, but it's the entire industry, right? Representing the entire ecosystem of MedTech, from the largest company and the CEO all the way down to the smallest company with a great idea. They're all there basically for the same thing, right? To learn, to network, and to partner with like-minded business partners to help improve the healthcare system, right? And that's what this is all about. And you mentioned it's grown. We've had a really good run over the last 5 years. We obviously took a dip during the pandemic, but we bounced back from that with just great energy. Last year we were in Boston, as you know, had over 3,400 people attended, which was a high water mark for us, the largest we've ever had. And this year we're going to be in California for the first time in a number of years, and the energy feels really good around this event in Anaheim, October 9th through the 11th. So it's an exciting time. Everyone's there, and it's a can't miss event.
I would agree, and if the audience members have not attended it, here's why it's really important. The fact, walking around the floor, you mentioned the CEOs of the mid caps and the larges, and they're there not, and I don't suggest for other shows they are, but they're there for access and conversation. Right. And you go to some of the other shows that are sort of vertical specific, they fleet in and out, they're there with their sales team, there's a commercial presence, but it really feels like you've got a one-to-one connection with these critical leaders at all levels of the ecosystem.
Yeah, you do. And part of the reason for that is the CEOs are involved in essentially the planning of the meeting. So it matters to them, right? They know from the earliest stages what it's going to look like. They all have a role to play in the meeting. They're fully bought into the value of the meeting, the importance of it to the ecosystem. They understand the benefit of them being there and being able to talk to people, whether it's business partners, potential business partners, their own employees, peer-to-peer conversations, right? All those occur. And I have found the CEOs find this as just incredibly valuable to them. And then, Joe, as you mentioned, others see them there and they realize the value extends beyond that. So it's a great event with great people. So I'm looking forward to it. We're excited about it this year.
And last year you showcased, I think it was for the first year, correct me if I'm wrong, is the Investor Forum.
Right. That was the first year we launched that. We have investors that have come to it in the past, but we haven't had a focused section of the meeting just for investors. So this is our second year of the Investor Forum, where we bring investors in to learn more, not just about policy issues, but about how to partner with some of our companies. And our companies can also learn from investors about what's important to them. What are they looking for? What matters as they're thinking about their investment? Those dialogues are really, really important. We've added to that this year, Jeff Shuren, who is an annual attendee, right? This year, he's going to be there to meet with investors as well. So investors can learn from federal regulators on the FDA side and hopefully on the CMS side, sort of what they're thinking and what the future looks like as well. Because from our perspective, what happens in the regulatory space and the policy space really matters to business outcomes, right? And so that's the value of having people like Jeff there to collaborate with the investors as well.
Yeah, and some of the observations I had heard, is every year we have a really nice spot on the floor that AdvaMed supplies us for, and we get to share the conversations with leadership and executives who are bending the curve in the industry. I did hear side chatter that said, while JP Morgan is a fantastic event, it's really not a MedTech centric event, not a medical device event. It's more for the biotech and the pharma. And there are those that have an inkling that this could be the investor event for medical devices to eventually emerge.
Yeah, you were listening well and perceiving very well, Joe, because that's where we're going, right? We want to try to create a fall JP Morgan-like event that's a little more focused on MedTech. In order to do that, you have to attract the right audience, and that's part of what we're trying to do with bringing the investors there. Then you need the companies to be there to do their presentations and have their conversations. And then the next phase of that is bringing the broader healthcare ecosystem in as well, hospitals, payers, others that are in and around our businesses as well, so we can have a full collection of the ecosystem that's touched by MedTech, and then that will really take off. And so JP Morgan is an awesome event. We're in no way critical of that, but it's gotten so big, and oftentimes it's hard to navigate your way around and see the people you need to see. There's so much to do there. So this will allow us to keep it a little tighter, a little more focused, and get the important people we need to see and do real good business there, because this is a policy conference, but it's also a business meeting, and we're trying to overemphasize that going forward.
Well, you mentioned something important before when you talked about where's policy going with Jeff Shuren, where's regulatory, at least, what's happening in the wind, what should we think about? Because investors make their decision based on the future forecasting, especially if they're a 10-year fund. And so understanding where that's going may be an unlock for investment as well.
Yeah, there's no question about it. We're so heavily regulated, and we're so heavily dependent on federal payers and private payers making determinations on how they're going to cover our products, that you can't separate out the manufacturing of a product from how it's regulated and how it's paid for, right? And so you need to see and learn the entire system and the entire ecosystem in order to make smart investment decisions, and also in order to grow your business the way you want to grow it. So that's why everyone needs to be there. That's why the ecosystem matters, and the connections between federal payers, federal regulators, private payers, and industry leaders is really important.
And I think that's about the only conference where you get that directly from the source, where oftentimes I work a lot in the VC environments, and you get the chatter that says, I heard, I think, somebody told me. But to be at a conference like that with direct line of sight from the people who are making those decisions is invaluable. Yeah. Scott, the people who should go to this, right? So last year when I was there, and every year I've been there the last few, is there's VPs of engineering on the floor, there's commercial people walking the floor, there's regulatory people on the floor. So what is the typical persona that would benefit most from going to this?
Really anyone who's in the MedTech space now, Joe. You mentioned some of the important categories, so I won't repeat those, but I would add to it, right? Human resources professionals as well. You spoke to one of our sessions last year about the importance of diversity, the value of growing your business in a way that's diverse, that represents the entire ecosystem. That type of professional needs to be there too. It's a great place to recruit. It's a great place to meet people, and it's a great place to learn from others what they're doing inside their companies to drive success, right? So that's another category of folks that needs to be there. I'll come back to what you said on the regulatory side and on the policy side. If you're at all interested in that space, this is the event that you can't miss, right? Because it's the freshest information, it's the latest information, it's a combination of perspectives that come, as we talked about earlier, from federal payers, but also perspective from senior leaders inside our companies on how they've dealt with some of the regulatory and payment hurdles that they faced as well. So the combination of that is really important. The last piece I would add that you didn't mention is legal, right? So if it's a general counsel or a legal team, we do continuing education throughout the year for those that are in the legal space. If you're in the compliance space or the traditional legal space, a really important meeting for you as well. From networking to learning, all categories are really valuable.
There was another part of the floor that was occupied that I thought was genius, and I hadn't noticed it years before, maybe as much, because we're watching more and more OUS entities start to come to the US. And you know, the presence there, and there was that international region and countries that, you know, a large part of our business is venture backed, and a reasonable sampling of that are coming to the US, trying to get a foothold in the US with their commercial team, you know, unpack the regulatory pathway, the clinical pathway, the reimbursement pathway. You also provide a space for them to get educated there.
Yeah, big time. I mean, yeah, we're not just a US based industry anymore, right? Originally, we're very proud of the fact that this was a US based industry. It's where the innovation came from. It's how it's grown. But we're a global industry. At AdvaMed, we're now a global trade association. So we touch every market around the world. So you have to have the international community come in and be a part of it, whether it's a country-based pavilion where a country would come in and talk about what's going on in their country, the challenges, the opportunities, the business opportunities, or it's us learning more about what the regulatory and policy challenges are overseas. Both of those are really important to us. The markets are huge, you know, from China to all across the world, to Europe, down to South America, Brazil, many other countries. Huge markets with a big impact we can have. And so that is a really important and growing component of what we're doing.
Scott, AdvaMed started to put on some real must-attend world-class events. As you go through the calendar, share with our viewers, what are some of the other events? And if you had to pick one, maybe two you can't miss, what would it look like?
I think it depends on what level you are in a company. I think if you're a CEO, there's two events you can't miss. One's the CEO Summit that we do in March of every year. A really important event just for CEOs. I think you've experienced that one with us, Joe, as well. If you're a chief executive, everyone you need to see and want to see is there. We have great sessions. We bring in outside experts, policy leaders, government leaders. This year we had professional football player Damar Hamlin who joined us and talked about his journey, his healthcare journey. So you learn, but you also are able to network, and then you get that peer-to-peer learning that you just can't find anywhere else, right? The lessons you learn from your friends who are running another company, who are interested in everyone's success, you just can't get that anywhere else. And the second one they need to attend is the conference, and we talked about that as well. If you're in the legal or policy space, it's the conference, but we also run year-round education programming at AdvaMed. Some of that is on-site here in DC. Others of that is now virtual, of course, since we learned through the pandemic, you could do a lot of that virtually as well. So we've got a curriculum that we run for all levels of leaders and also employees inside MedTech companies that they should participate in. We should post that and share it, Joe, so the broader community can see all that we do. But there's a ton of things we do in DC and remotely where everyone can learn a lot about what's going on in our space.
And as somebody who had the opportunity as a CEO to attend that CEO conference, you do not have to be a big strategic CEO or even a large mid-cap. The intimacy that you arranged in those meetings, the single room, the social events were just enough. And to your point, the educational events by ex-politicians who gave you a peek behind the scenes, right?
Right.
Others who had worked in government had given you insight as to what you should be thinking about as you navigate your company. That I speak to so many startup CEOs and insist that they lean into AdvaMed because most of them are not coached. Most of them are led by boards who might not be intimately familiar or spend more than 1-2 days per quarter with their CEOs. There's a responsibility to CEOs at all levels to get with peer groups and establish those networks together. So I want to make sure that people make a note of that as well.
Yeah, I would add to that, Joe. You're exactly right. The way you stated that is perfect. But I will say the large CEOs don't want to come to the event if it's just the large CEOs only. They enjoy the opportunity to talk to and network with the mid-sized companies, and especially the startup companies. They have a lot of fun, I think, helping young CEOs or aspiring CEOs who have a great idea and they're trying to get it to market, help them understand what it takes, help them understand what they might be looking for down the road if they're going to purchase a product or buy a company in that space. And so part of the joy in the large company CEOs attending is that opportunity to teach and learn from the small companies as well. So it's really important to us that the entire ecosystem is covered in every event that we do. So I'm glad you found that there, and that's a really important component of it.
Yeah, it's funny, just a personal matter. I sat down to have lunch. I had my chief of staff with me, and Jeff Martha sat down, mind if I sit here? And then Ashley McAvoy sat over there, Mike Minogue sat at lunch, right? That kind of mix. And Kevin and I, Lobo and I, were passing each other in the bathroom, and he says, "Love your stuff on LinkedIn," and just, you know, so it's it's really that friendly of a conference where too many times you might think that those types of CEOs you don't have legitimate access and just conversation with.
Yeah, it's great. They love it. I love it. Obviously, you enjoy it as well. It's a highlight of every year for us.
So AdvaMed's done some magnificent things for the industry, you know, over the years. What's the vision forward? You know, you've set some high bars everywhere. Where are we going from here?
Yeah. So, Joe, let me back up and say there's 4 things about AdvaMed, if you don't know the organization, that you should know. 4 primary things that we do, 4 pillars of work that we do. It's policy and advocacy, which is critical to the success of a company. It's the education and programming that we talked about before. It's the networking that we do at these events and outside these events. And then the 4th piece is really the business development and partnering work that we do. So we covered those 4 areas. Our wheelhouse in many ways is still in the policy and advocacy space. It's so critical to our companies that the business environment is right in order for them to be successful. And so we try to do our best, working with Congress and with the administrations, and then with governments around the world as well, to try to shape that policy environment to give our companies the best chance to be successful, right? We can't ensure it. They can't ensure it, obviously, as well. But a lot of what we're doing is trying to make sure that every policy that moves through Congress, every regulation that comes out of an administration, that we have our hands in that, and we're trying to shape it either to make it better or make sure it doesn't do any harm to the industry. Because oftentimes, well-intentioned policies end up harming an industry, right? And so that's what we do. I would highlight one thing, and we can talk about a lot of things in this area, Joe, but one thing that's really important to us that you and I have talked about a lot is the importance of clarity in payment policy. We've made so much strides in the right direction on the regulatory side. We talked about Jeff Shuren and FDA as well. You don't always love the answer that you get from FDA, but you really pretty much know the roadmap to get to an answer, right? And you know what information you need to provide in order to get an answer, and likely a good answer, or at least a meaningful answer. I think the gap in policy right now for most of our companies is on the payment side, where it's very opaque. It's still unclear. There's a lot of uncertainty. There's a lot of inconsistency in the process. So we have focused a lot of our work this year on trying to shore that up. And we saw from the administration a regulation that came out recently that wasn't as good as we had hoped, but it was definitely better than what exists now. So we were encouraged by that. We had a hearing in Congress about a week ago to talk about not only that regulation, but legislation that would improve on that regulation, that would bring that predictability and clarity to the payment process. So we were very focused on that. It's become a bipartisan initiative in Congress now, which is also very encouraging in a very partisan time, right? To see the chair of the committee and then also the ranking member say essentially the same thing. You've got to get this right in order to improve innovation. So we're really encouraged by that, and we're hoping that we can get the TSIT rule or a version of that rule in the right place with a combination of regulatory action and maybe legislative action if the regulation isn't right. Because if you can get the payment environment right, and now that you have the regulatory environment right, you see all the innovation, Joe. I've seen you move around the country and around the world and see what the opportunities are for us in this space. If you get the policy environment right, the innovation is there, and then it is going to take off. And that's what we're focused on.
Yeah, and we're thankful for that, especially too, because the biggest challenge you have, and you hear it behind the scenes, is the misalignment of incentives. And if we can't get those aligned, we'll choke down innovation, we'll choke down investments, because investors, the last thing they want is unpredictability. So you need a predictability in that pathway. So what are we going to focus on the next 12, 24 months, Scott, in regards to, in addition to what you shared, what are we going to focus on additionally for our viewers?
So I would say two things, maybe three things. One, after TCET is resolved, and I feel good about the direction we're going on payment policy, we are currently working on and continuing to work on the next phase of the MDUFA agreement. So many of you viewers may know we passed a new regulatory agreement with FDA last year. We're now moving into the implementation stage. As much progress as we made with FDA over the past 5 or 10 years, there's more that we can do, right? During the pandemic, we saw some lags. We saw delays in approvals. We saw things slowing down for good reason in many ways, but we're now past that, right? And so we want to move FDA from a very good organization in dealing with MedTech to an excellent organization dealing with MedTech. So the timelines are quicker and the process is better. There's always ways to improve that. I feel good about the direction we're going, but that's going to be a priority for us this year. There's another issue we may have talked about before is the regulation of sterilization for products in MedTech, a huge issue. There's a rule coming out of EPA that if not done right could have a real chilling effect on the sterilization industry, which, as you know, is critical to patients. If you don't sterilize, you're not getting products, right? And so we're working on a new regulation that is probably going to be implemented at some point in 2024. If we get that right, we're going to be in a great spot. If the administration doesn't get it right, it's going to pose a real challenge for us. And then, Joe, I think the third thing that we're always working on is making sure the image of the industry, the perception of the industry lives up to who we are, right? There are always attacks that come at you from either ill-informed sources or media sources that are trying to redefine and define who you are. That's an ongoing battle. You saw an article maybe in the New York Times last weekend. That was unfortunate, right? I mean, it was skewed in one direction, not the right direction, a lot of misinformation. I think it would cause patients to be concerned about the quality of the MedTech products they're getting. And the reality is it just wasn't fair and it wasn't honest, right? Our job is to make sure we're setting the record straight when the media takes something, takes a narrative and spins it in the wrong direction. Because if you're not careful and you don't fight back on that, right, it can end up taking on a life of its own. And so we saw that article. We've seen other suggestions that people were going to raise questions about the value of this technology. And our job is to make sure we're protecting the industry and clarifying the value this provides to patients in the healthcare system. So it's really those three things over the next 12 months we'll probably be focused on, Jeff.
Yeah, and super thankful, me being somebody who's built a career and certainly have impacted, tens of thousands of lives. An organization like AdvaMed that stands there making sure that there are no unintended consequences made by a less than educated cohort, not their fault, in Washington, right, because they don't understand longitudinally what a decision potentially can do downrange.
Yeah, that's exactly right. And it's, as you said, it's not necessarily their fault, right? They may be thinking they're doing the right thing, but what they end up doing could really cripple innovation. And not just innovation. I always say this when I'm talking to folks in Washington. Innovation's important, but the reason innovation is important is because patients are suffering. And patients are suffering, that means they need treatment, right? And we're innovating to make outcomes better for patients. That's why it really matters at the end of the day. And so well-intentioned regulation and legislation also times can have a really negative impact. And we have to make sure we're staying on top of that and fighting that whenever we can.
Well, all of us in the industry are thankful for you and your team who do such an effective job at that, Scott.
Yeah, thanks, Joe.
Is there anything we didn't cover today that we should have?
I don't think so, Joe. I think we've covered it all. It's an exciting time to be in MedTech, right? I mean, I love watching you move around the globe and see all the things that you see. It's fascinating to watch and keeps our spirits high about what's to come, right?
Yeah, well, I'm privileged to have the opportunity to people who sort of let us in and give a peek behind the scenes. So myself and my team are thankful for that.
Good deal. Awesome.
Well, Scott, as usual, thank you, my friend, for sharing where we are. And we will make sure that we have the contact info for the conference listed on here right below. And as usual, I will see you out in LA and keep up the great work.
Look forward to seeing you at the MedTech conference on the floor in October.
You got it. I'm Joe Mullings from 160 Studios. Be well.